Hello, everyone. I'm Andrada from the University of Detroit Mercy School of Dentistry, and I'm here with my colleagues from the Emerging Leaders in Academia program to present our research titled Student and Faculty Perspectives on Clinical Feedback Methods as an Assessment of Competency and Independence. We are the group ACRONYM because we stand for something, and our mentor was Dr. Deborah Dilbone from the University of Florida College of Dentistry. So the ADEA defines competency as the ability to begin independent, unsupervised dental practice. Competency includes knowledge, experience, critical thinking, and problem-solving skills, also professionalism, ethical values, and technical and procedural skills. So upon graduation from a dental program, we expect that students should demonstrate an appropriate level of competency to allow them to start independent practice.
This is Courtney Schapira from the University of New England College of Dental Medicine. There are 5 stages of learning for all dentists: novice, advanced beginner, competent, proficient, and expert. Proficient and expert, although important, happen later in a dentist's career and have to do with things like years of experience. While in dental school, students will travel through the phases of novice, advanced beginner, and graduate competent. The novice student is early on in their education. These students lack the experience to relate the knowledge they're obtaining to real situations. They're merely following rules at this stage. The advanced beginner is starting to experience real situations, and these students are developing their understanding as things are becoming more relevant. It's at this stage that the student must begin utilizing feedback, self-reflection, self-learning, and clinical experience to progressively increase their independence as a clinician. And upon graduation, students should be graduating competent or able to practice independently. These students are able to make educated decisions based on the feedback, self-learning, and self-reflection from previous clinical experiences, and are able to use their acquired knowledge, experience, critical thinking, problem-solving skills, professionalism, ethical values, and technical skills to practice independently.
So as we consider our students progressing from novice to competent, knowing how important feedback is in this progression towards independence, we need to keep in mind 3 important questions. Are the students getting the feedback they need to become more independent? Does our current feedback method demonstrate the student progression towards independence? And are we setting our students up for successful independence practice once they graduate? So with those questions in mind, and knowing that a universal system for tracking a student's progression towards independence practice has not yet been developed across dental institutions, the aim of our study was to evaluate student and faculty perceptions at 5 different dental institutions of their current clinical assessment system as a measure of student independence and also faculty ability to track student progression towards independent, unsupervised dental practice post-graduation.
This is Pinar Emecen-Huja from Medical University of South Carolina, and I will describe to you the methodology we used in our project. Initially, we did a literature review utilizing PubMed, and we looked for keywords such as competency-based clinical education, competency-based dental curriculum, and trustable professional activity and clinical feedback methods. Following the review of our literature, we developed 2 surveys for faculty and students. Each survey included 15 to 16 questions. We already utilized a standardized and pre-recorded presentation explaining independence as a clinical measure of competence. Each faculty applied to IRB for this project, and the dissemination of presentation and faculty and student surveys through emails or in classroom was done for data collection. And finally, we combined the data from 5 institutions, and we are going to share with you our results as counts and percentages. In our survey, we collected demographic information from faculty and students. We asked their gender and ethnicity, For faculty, we were also interested in knowing their area of expertise and year of graduation. And for students, we were, in addition to their demographic information, we were interested in knowing their year of education. Our survey included common domains of questions for faculty and students. For each participant, we were interested in understanding of their clinical independence, which methods they use to deliver feedback or self-reflection regarding clinical skills. What are their opinions on the importance of demonstration of clinical independence? How satisfied they were for assessment of clinical feedback and independence measures in their institutions? And in their opinion, which will be a better measure, number of procedures or level of independence?
Hello, this is Scott Howell from the Arizona School of Dentistry and Oral Health. And while Pinar listed a variety of different measures that we gathered, for the sake of time, we're just going to look at a few here. So on the left, we have how satisfied are you that the school's current assessment or feedback system measures independence? And as you can see, students in blue and faculty in gray generally feel that their systems do a pretty good job of measuring independence. You can see faculty are a little bit more dissatisfied overall, but we hope to do some more analysis that will actually give us some data demonstrating whether or not these are more related to each other, or if they are, if these are true differences. We can see on the right side, in your opinion, how well does the current assessment or feedback system allow you to track a student's progression towards independence? The different question being tracking over a period of time from beginner to competent. And again, you can see students and faculty generally feel about the same, but there might be some differences statistically that we hope to look at. But generally, people feel that the systems do allow them to track. Not only are they measuring, but the tracking allows us to determine over a period of time from the D1 to the D4 year if there's competence being attained. Generally, there are a few people though in the 15 to 20% range that they're still feeling that the systems don't track independence. In your opinion, how important is it that students complete a specific number of procedures prior to graduating? Again, students and faculty are trending about the same, with most people feeling that it's pretty important that students complete a certain number of procedures, with faculty appearing to be a little bit more supportive of that idea, and some students thinking that it's not important at all. In your opinion, how important is it that students demonstrate independence in completing procedures prior to graduation? And here you can see overwhelmingly, nearly 50% of both faculty and students think it's extremely important that people demonstrate independence prior to graduating, with no one saying it's not important. And lastly, when we force their hands, in their opinion, if they had to pick one or the other, which would be a better measure of competency, you can see that overwhelmingly people feel that level of independence, upwards of 70% here. The level of independence is going to be much more important as a measure of competency.
So let's talk briefly about a student's progression from novice to competent or independent. Again, competence is the student's ability to learn from feedback, instruction, and guidance, and then being able to apply this knowledge and experience to future patient encounters for improved outcome and increased autonomy or independence. One significant obstacle that can slow this successful progression towards independence pertains to inadequate feedback. Occasionally, it's either not given effectively by faculty. There's sometimes this perception that students only want to hear praise, or it's not perceived effectively by students. Again, sometimes corrective feedback can feel a little personal and threatening to students with little experience with this type of interaction. Next slide. Two important questions were asked during the survey. First, in your opinion, what is the biggest challenge to students achieving independence for a clinical procedure during dental school? Although the responses were varied and covered a broad spectrum of opinion, these are some of the responses received from faculty and students with regards to feedback. The bullets that are bolded represent some of the obstacles with regards to feedback as discussed on the previous slide.
Hello, this is Leticia Guajardo from the University of Texas School of Dentistry at Houston. The second important question asked during this survey was, in your opinion, if you had to pick either the number of procedures completed or level of independence, which would be a better measure of competency? 87% of responses indicated level of independence as being the better measure of competency. This slide gives an example of a feedback method that facilitates tracking a student progress towards independence. This form is currently being utilized at the University of New England College of Dental Medicine, one of the schools participating in this study. Future steps. The results have been obtained and analyzed from 4 of the 5 institutions involved in this study. MUSC plans to have results submitted by the end of the spring semester. Further statistical analysis will be completed once all results have been received. Analysis will be made of the independence-based feedback system currently being utilized at the University of New England, considering the following questions posed in the aim of our study. How well does this independence scale demonstrate a student progression toward independence? And how well does this independence scale allow faculty to track students' progression towards independence? Unsupervised dental practice post-graduation. Findings and recommendations will be made based on this analysis. We plan to draft our manuscript this summer. We would like to thank our mentor, Dr. Deborah Dilbone, for all her support during this time. Thank you for your attention.